Hi there, I'm Nurse Rob. Now I'd like to go over some of the symptoms of neonatal abstinence syndrome. In this lesson, we will talk about symptoms related to fetal brain chemistry changes.
That's right, Rob. We will also describe symptoms that apply to neonatal opioid withdrawal, or NOW. At the end of this session, we want you to be able to identify 3 symptoms of neonatal abstinence syndrome, NAS, or neonatal opiate withdrawal, NOW. Identify 3 special considerations for signs or symptoms of NAS in the preterm infant. Relate current research findings that describe signs and symptoms of NAS and NOW. And identify 2 factors affecting severity and duration of NOW. Neonatal abstinence syndrome, or NAS, is a clinical diagnosis caused by the immediate withdrawal at birth of the prenatal exposure to substances used by the mother throughout pregnancy. NAS can be caused by the withdrawal, after the umbilical cord is cut, of a variety of substances that have crossed the placenta, but it is most often associated with opioids used by the mother during the pregnancy. As I told Nurse Rob before, the Substance Abuse Mental Health Administration, or SAMHSA, recommends the term neonatal opioid withdrawal, or NOW, to specifically refer to opioid withdrawal. When pregnant women use opioids regularly throughout pregnancy, the neonate often experiences severe withdrawal symptoms requiring lengthy hospital stays.
Thanks, Amy. That's serious. So now let's talk about the pathophysiology of NAS. The exact pathophysiology of NAS is currently unknown. The signs and symptoms of NAS are caused by the hyperstimulation of the central nervous system due to abrupt cessation of opioids being bound with the mu receptor. Opioid receptors are located largely throughout the central nervous system, but can also be found in the gastrointestinal system, the peripheral nervous system. A drastic reduction in the amount of opioids leads to increased opioid receptor activity, eventually resulting in changes in neurotransmitter levels. Neurotransmitters commonly affected include norepinephrine, dopamine, acetylcholine, and serotonin. So, Amy, what should we know about the symptoms?
Well, Rob, signs and symptoms of NAS vary drastically based on multiple factors such as the duration of substance use by the mother during pregnancy, the mother's use of other medications or substances, polysubstance use during pregnancy, and the gestation of the newborn at birth. The type of opioid also makes a difference in terms of placental transmission. Synthetic opioids cross the placenta at higher rates than semi-synthetic opioids. If the mother is combining the ingestion of several drugs concurrently throughout her pregnancy, the permeability of the placenta is further increased, placing the infant at higher risk for NAS. The older the gestational age of the infant, the greater the amount of opioids that can transmit across the placenta. Newer data indicates that chronic exposure to opiates can lead to modifications of opioid receptor gene site. Opioid receptor gene variants have been associated with more severe NOW that require more adjunctive medications. So, Rob, what are some of the symptoms that result from chemical changes in the brain?
The first symptom is sleep reduction. Sleep deprivation in infants experiencing NAS is caused by the reduction in serotonin production in the dorsal raphe nucleus. This leads to interruptions in the sleep patterns of newborns withdrawing from opioids. The second symptom to discuss is excessive crying. Excessive cry irritability is associated with dopamine decrease. Dopamine release becomes decreased from the ventral tegmental location of the midbrain, the dopamine storage location. This drop in dopamine often causes extreme irritability and excessive cry. Next, we should discuss tremors. Tremors, or norepinephrine release. When mu receptor sites have been chronically stimulated by the presence of opioids, there is an increase in norepinephrine. After the opioid no longer fills the mu receptor after birth, the increased norepinephrine can lead to tremors. This is particularly common during methadone withdrawal. This increase can also lead to increased blood pressure and heart rate, tachycardia. Elevated temperature may also be a sign of increased norepinephrine.
Thanks, Rob. The locus ceruleus, LC, is an area of the brain that is critically involved in the production of opioid dependence and withdrawal. The diagram you see here shows how opioid drugs affect processes in the LC that control the release of noradrenaline, or NA, a brain chemical that stimulates wakefulness, muscle tone, and respiration, among other functions. Normally, natural opiate-like chemicals produced by the body link to the mu-opioid receptors on the surface of neurons. This linkage activates an enzyme that converts a chemical called adenosine triphosphate, or ATP, into another chemical called cyclical adenosine monophosphate, or CAMP, which in turn triggers the release of NA. Prior to initiation of opioid drug use, the neuron produces enough NA to maintain normal levels of alertness, muscle tone, respiration, and etc. Once the umbilical cord is cut and opioids no longer fill the mu receptor sites in the newborn, there continues to be an increase in norepinephrine. This results in some of the symptoms of NAS. Rob, we should tell everyone that every infant with NAS may display a different set of signs and symptoms dependent upon a multitude of influencing factors. Onset of NAS will depend upon the substances used by the mother during pregnancy and the gestational age of the newborn. Approximately 2 to 49% of newborns whose mothers used methamphetamines during pregnancy will display NAS symptoms around 24 hours after birth. 40 to 80% of newborns exposed to heroin will display symptoms at 24 to 48 hours after delivery. 13 to 94% of newborns exposed prenatally to methadone will experience the onset of NAS at 48 to 72 hours. 22 to 67% of newborns prenatally exposed to buprenorphine will have NAS onset at 12 to 60 hours post-delivery. 5 to 20% of newborns exposed prenatally to prescription opioid medications will have onset of NAS at 36 to 72 hours following delivery. This is dependent upon the drug half-life. Clinical presentation of NAS demonstrates interruptions in 4 general areas: control of motor muscles and tone, attention and state control, autonomic system regulation, and response to sensory input.